I'd like to call the Lawrence County Developmental Disabilities Board meeting to, I just lost my train of thought, to order on June the 8th, 2021 at 6 p.m.
Mr. Gore,
Here.
Mr. Huff,
Here.
Ms. Jones,
Here.
Mrs. Marks,
I'm here.
Ms. Pyle,
Here.
Mr. Smith,
I'm here.
Mr. Thompson.
Here.
Excuse me. With the agenda, there's one small change, and that is the announcements are going to come before executive session. So after we do the annual report that Julie was talking about, we'll do the announcements and then we'll go into executive session. Any public announcements, Larry? Or public comments?
There are none.
Okay. Did everyone read the May minutes?
Yes.
Yes.
Is there an approval? Is there any discussion about them or any changes that you know of? If there's not, is there an approval for the May meeting minutes?
I'll make the motion. I'll second it.
Mr. Gore, she gave me
I said yes.
oh, sorry.
We didn't hear you.
Mr. Huff,
Yes.
Ms. Jones,
Yes.
Ms. Marks,
Yes.
Ms.
Yes.
Pyle,
Yes.
Mr. Smith,
Yes.
Mr. Thompson.
Yes.
Okay, there are no committee reports. Finance and expenses, Amy.
Yes, ma'am. General fund revenues exceed expenses by 1.6 million through May 31st. That is because we received 1.8 in our first half real estate tax settlement on 5/11 and 20,653 in the first half manufactured home settlement on 5/21. Jeff also received a school safety grant for $2,500 on May 3rd that he's going to use for school nurse supplies such as tourniquets and stop the bleed kits. So budgeted revenues through May are at 81.93%. Expenditures are slightly under projections, very slightly. We also, I gave you the totals of where we are for DC services through May. For one individual, we've spent a total of $24,125.72 with $10,643.70 coming in April. And we have a new individual who we've spent $992 for. That was for April 23rd through April 30th at $124 a day. And I will keep those summaries going every month for you if that's okay.
If I can add something about the
Yes.
DC placement. I was on a meeting with Director Davis and I did bring that up, that with the state, with them taking away the 180-day free stay, that it was, particularly hard on county boards to absorb all that cost. Because we're really forced to, because there's no other options available to us. So I just wanted you to know that I did make that request that he look into that issue.
That's good.
Yeah.
That is good.
And I'll put it in writing as well.
Okay.
We're not the only ones in this situation, so.
Yeah.
Okay, is there anything else? Is there a motion to approve the May finance?
I'll make the motion.
I'll second it.
Mr. Gore,
Yes.
Mr. Huff,
Yes.
Ms. Jones,
Yes.
Ms. Marks,
Uh,
Ms. Piles,
Yes.
Mr. Smith,
Yes.
Mr. Thompson.
Yes.
Superintendent report?
Well, I was on vacation last week and I came back and saw after I said that the rate increase for waiver services was not going to be included in the biennium budget. It is now included in the biennium budget. There's going to be a 2% state funded increase each year for waiver services. And the purpose of that is to, again, try to put more funding and annual increases into the provider system. Also, just wanted to mention, as far as state news goes, that up in Sandusky County, they have had a crisis. We've been in a crisis for a long time with our direct service professionals. It's just hard to find people to take on the kind of responsibility that is required in this field for the pay. And up in Sandusky, I guess, Cedar Point, different places are paying, a lot more, and they're in a true crisis to the point where the county board staff are having to go provide direct care service. I mean, there's no option. There's no choice. So, I'm going to keep an eye on it, but it's just, it is a very, it can be a very challenging job. It's a very rewarding job, of course, but it can also be challenging with all the responsibilities. So anyway, I just wanted to let you know that that rate increase was approved. What we will be responsible, how it will fall back onto us, I don't know yet. I'll have to get into the weeds on that, but I guess most of it's going to be state funded. And I do have a couple policies down below that I just wanted to make sure you knew that we are working on procedures and new policies for reopening. We just don't have those done yet because we're still receiving guidance. But I just wanted to share that. I'll get into more of that when we get to policies. That's all for the report.
Okay, is there any old business?
Not that I'm, no, none listed.
Okay, then Julie, new business.
Okay, the first policy revision that I'm requesting is our sick leave policy 1405. You just approved this last month to take out the sick leave incentive program. But one of the things that came to our attention, if you go to the second page of the policy, and there's a little line there in strike through where you can see what we're proposing to change. The only change is on the second page. And our current practice is that we, if an employee is expected to be on sick leave for more than 3 scheduled work days, they must notify their supervisor and submit a statement to the supervisor, not 5 scheduled work days. So we actually had 5, but the practice is 3. So I wanted to clear that up. And then at the bottom, it says if an employee uses sick leave, it did say for more than 5 occasions. Well, that's very vague. And again, 3 days is kind of what our practice is. If an employee uses sick leave for more than 3 consecutive days, we will be asking for a medical statement, not 5 occasions. Because what's 5 occasions? It's open to interpretation. So this was written by an HR consultant, and it's just something that we did not catch a couple years ago, but the staff have been doing everything in practice on 3 days. 3 consecutive days for a doctor's excuse and 3 scheduled days off, they need to notify us. So that's the only changes that I'm asking the board to make.
Well,
Okay.
You need-
So, is there any questions about that? Is there a
No.
motion to approve the revisions to the sick leave policy 1405?
I'll make the motion, Debbie.
Thank you, Lou. I'll second it.
Mr. Gore,
yes,
Mr. Huff,
Yes.
Ms. Jones,
Yes.
Ms. Marks,
Yes.
Ms. Piles,
Yes.
Mr. Smith,
Yes.
Mr.
That was Mr. Thompson. Is it-
Yes.
Okay.
I
Got
couldn't
it.
hear you. I couldn't hear you.
Yeah, it cut out. I think only the sun got in there. Okay, face coverings.
Okay, with the recent health orders ending, we no longer need this policy. However, as you will see, we do have a policy that kind of replaces it as far as home visits go for early intervention coming up. And I just wanted to say a few words about this. I have made it very clear to the staff that, you know, if they want to wear a mask and they've been vaccinated, then that is their choice and they should feel comfortable in doing so. And I've also made it clear that we're not going to require proof of vaccination, but I am expecting that if they have not been vaccinated, they'll do the right thing according to the health order, which is still wearing masks. Now, we all know, you know, that's what the health order says. If they've been vaccinated, they don't need to wear a mask. So I sent all of that out to the staff along with the health orders as they now, you know, as the guidance that we have from the CDC. But I just wanted you to know that we don't have a need for this policy at this time. So I would like to go ahead and get it off the books so we don't forget about it later. So I'm just asking that you abolish it.
Is there a motion?
Motion.
Second it.
Thank you, Sarah. Thanks, Tanner.
You're welcome.
Mr. Gore,
yes,
Mr. Huff,
Yes.
Ms. Jones,
Yes.
Ms. Marks,
Yes. Yes. I wasn't sure if you heard me or not.
Mr. Smith,
Yes.
Mr. Thompson.
Yes.
Did you skip me, Lisa?
No, I said you and I assumed maybe you were doing it and I couldn't hear you. Because yeah.
I didn't hear you. That's fine.
So you're a yes?
Yes.
Okay.
The EI home visits.
So since early intervention is provided in the homes, primarily, it's the way it's always been, they're usually the first to come out with guidance about how to do home visits now that, you know, the health orders have been rescinded or, you know, no longer in force. So we are required to have a policy, and it's basically the language that they sent us. I tweaked it a little bit, but the early intervention program is to go by this policy for resuming home visits. And they are also to develop procedures to guide that in accordance with the policy. And Jamie is currently working on that. with the early intervention staff. And I believe right now what they're doing is they're working on a poll with all their families to see, first of all, who wants a home visit, who wants to resume home visits, and who would maybe want to prefer to stay remote. So they're able to do either, but that's how they're, starting the process of resuming home visits. So my plan is, like I said, we're required to have this policy to guide that. At the next board meeting, I would like to have a policy that covers everyone, as far as home visits for our SSAs, and as SSAs start coming back and doing more things in person. Right now, we're still kind of unofficially operating the way we have been, but I am going to be putting together a policy, and we will have procedures to guide, them as far as dealing with home visits and meetings and so forth. So I just wanted to let you know that. I just haven't got to that piece yet because there's been no guidance put out yet for that, but I'm sure there will be. And as far as our direct service staff, any direct service staff are required to, like providers, are required to follow the health workers guidelines from the CDC. So they do still have to wear a mask. If they're working with an individual in their home, or like at a developmental center, or an ICF or something like that. But we don't directly employ any of those staff. But we do need to think about, like, when our SSAs, like I said, start resuming home visits. We need to have, I'd feel more comfortable to have something in place with just some general guidelines, on how to handle different situations. So I just want to let you know that is coming, and that will be coming next month. But so far, this is what we have for early intervention, and I would need approval of this so we can get it going.
Is there a motion to approve the new policy?
I'll make the motion, Debbie.
Thank you,
I'll
Lou.
second it.
Thanks, Mike.
Mr. Gore,
You're welcome. Yes,
Mr. Huff,
Yes.
Ms. Jones,
Yes.
Ms. Marks,
Yes.
Ms. Piles,
Yes,
Mr. Smith,
Yes.
Mr. Thompson.
Yes.
Yeah, it's something I forgot to mention. You may have saw in the policy, but they're DODD is allowing the virtual visits, virtual evaluations, at least until August 31st. So we'll see where it goes from there.
Okay.
I didn't get it. Go ahead and eat or whatever you gotta do.
All right.
Insurance renewals.
Go ahead and eat, and then you can come.
I think Amy's going to talk about these.
Okay, I wasn't sure if you wanted me
Yeah.
to or if you were.
Yeah.
Okay, we received our renewal proposal from Ohio School Plan. And I'm very excited to tell you that the premiums dropped from $33,567 to $26,277.
Yeah.
And of course, those decreases are due to the reduction in property values and a reduction in clients served with us closing the ECC building and closing preschool. But it's very exciting that our premiums in turn dropped as well. Many times you don't see that. So that was exciting. We also have a proposal. Are these two separate? I apologize. I'm looking at my screen instead of at the agenda. Are these two separate?
Yeah, I'd like a motion for
Okay.
each of them.
Okay. Yes, ma'am. So if we could have your approval on this.
I'll make a motion.
Thank you.
That's for the Ohio School Plan.
Yes, ma'am.
Okay. I'll second the motion.
Mr. Gore,
Yes.
Mr. Huff,
Yes.
Ms. Jones,
Yes.
Ms. Marks,
Yes.
Ms. Piles,
Yes.
Mr. Smith,
Yes.
Mr. Thompson,
Yes.
Okay. Would you like me to go forward with vision, Miss
Yes.
Debbie?
Yes.
We also have a proposal for our vision insurance, which renews August the 1st. It is for the same company we've been with, Brown Rayburn. They're our agents, but vision is through VSP. The total cost currently is $16.90. And the board pays $13.52 of that. The employee pays $3.38 of that. And the cost is the same whether you have employee coverage or employee child or employee family. The cost is the same for any type of coverage. The change to the plan would be the breakdown of the copays. Otherwise, the plan is staying the same. The copay is going to stay the same at $20. But eye exams and materials would be $10. Under the old plan, they were $7.50. Materials for lenses would be $12.50, and under the both copays would be $10. Forgive me. Under the old plan, eye exams were $7.50 and materials were $12.50, and here they'll be 10 and 10. So the copay will still be $20. The only change other than that would be an increase of 13 cents from $16.90 to $17.03. And we would like to continue to cover that cost for the employee, but would need your approval to do so. So it would go from 13 cents from $16.90 to $17.03. And so the 13 cents for the board would be $13.52 to $13.65. And the employee would stay at $3.38.
It's not much, and we did have an increase in our insurance this year, so we were thinking we would, pick that up.
I agree. I think that's very reasonable and
Yeah.
very appropriate. It's good coverage
Hmm.
for the employees.
Yes.
Is there a motion to approve the VSP plan?
I'll make the motion.
I'll
I'll
second it.
second. Oh, go ahead, Steve.
Mr. Gore,
Yes.
Mr. Huff,
Yes.
Ms. Jones,
Yes.
Mrs. Marks,
Yes.
Ms. Pyle,
Yes.
Mr. Smith,
Yes.
Mr. Thompson.
Yes.
Okay, and the annual report?
Yes, I'm sharing my screen. Can everyone see this?
Not yet.
You can't see it?
No.
No.
Can
you see it?
Yes. Okay, let me get everyone back here. Okay. So Larry, I just hit share screen, right?
Yes.
Oh, something's happening
There
now.
there
Yeah, I
is.
see it.
There it is.
Okay. Okay, so we are almost done with this annual report. It has been a work in progress. But this is the first page, and this is a draft. Tim is working on making all these changes, but I wanted to get this out in July, which means I got to have the draft approved. So we just marked up what he's working on. And if we could get your approval on this, then we can move forward. but this is the 2020 report. Now let me see how I get to the next page.
Hit the down arrow.
Oh, okay. So I did a little blurb up here. And these are our numbers. This is something we're supposed to report, you know, to the community every year. These were our numbers in 2020. And we're going to make these pictures, I think, a little bit bigger. And because we got all your lovely pictures there.
Oh,
And underneath of your pictures, you know, we have something, you know, just thanks for your support, you know, blah, blah, blah. So it would seem like it was coming from the board. So any questions before I switch the page?
No.
no.
Now this gets kind of crazy here, but so one of the things, this is our highlight section. So we're spotlighting people, individuals, and I like to spotlight a person from every program. My only problem with these pictures is that they don't actually show what the person is doing. So like, you know, we talk about Alex and he is, you know, working at his cash register and he's learned to do that. And we talk about Mason, you know, climbing and walking now because of early intervention. So I've asked him, we're going to get pictures of these people doing these things. And instead of just a facial shot. And then of course we want a picture of Tanner's dog. And I know, Tanner, that you don't have the dog yet, but I know that you've got pictures with him, right? Or got pictures of the dog.
Yeah, he's actually coming Monday
Great.
again. And Monday, from now going forward, he'll be the only dog that Alex has in training. So
Okay.
I should be able to like get that sped up
Okay.
from
Cool.
all of what Alex had been like dealing with earlier in the year.
Okay. Well, what we wanted to show is that even in the year of the pandemic, you know, people are making progress. All these people are making progress. But like I said, I want these to be bigger and to include them doing what we say they're, you know, what they've accomplished. So we're changing that.
Something else that I wanted to ask you,
Yeah.
Julie, is I'm getting a piece of equipment, but it's not through the DD services, but it's through OOD. But if for some reason OOD wouldn't, if they would for some reason take the piece of equipment back, what I'm asking is, why I'm asking this is because I've already talked to my SSA and she had got all the like approval if no other option is viable to get the piece of equipment if for some reason like it needs to be sent back or something.
Mm-hmm.
So would that be another like possible?
Right. What we're trying to do here, Tanner, is we're just focusing on 2020.
Okay.
And we want it to be very simple about what people achieved, you know, in 2020.
Okay.
So, I mean, that might be good for another story, but I think if we just got your service dog, that would be enough.
Okay.
And then down, what I also wanted to do, like a little tribute to our providers, because in 2020, especially our residential providers, you know, they dealt with a lot with the pandemic. And I wanted to just acknowledge them. And so Natifa, she's the director of supported living for NECO. That's one of our larger residential programs. And she's just a really good partner and works, you know, really well with us. And we just wanted to let the public know that, you know, they really came through, all the providers did. And I put in here, you know, the service provider, but I did want to highlight somebody, and she does a really good job. And then down at the bottom, we're going to redo this a little bit, but we have our values, vision, and mission. So any questions on this page?
No, I don't have.
So this is what we're really required to report. We always just add some highlight stories, but I did make several changes to this. And what I want to do is I want to simplify everything and for the public. And if, you know, if someone had like specific questions, I mean, we can go through the budget, but like for the purposes of what this is for, I really just want everything broken down into programs. So like, you know, this is what we spent on early intervention. This is what we spent on preschool, and we're going to add that it ended, you know, 19 and 20. We no longer have preschool. This is what we spent for school age. But the adult and community services, for some reason, everything, we had it kind of split out by different, like the Medicaid match, and then SSAs, and then we had another number here for like respite and different things. But really, that's all one program. So I'm taking out like Medicaid match for HCPS, because a lot of people aren't going to know what that is.
Right.
And just put everything down here to say, these are our programs. The adult and community services obviously is our biggest program. That's the 1.766. And then we have the capital housing program, which is really just a pass through, but we have to report it's the wash basically, because it's going to be, we get revenue down here in the state for that, but we still have to report it. So we basically have EI, school age, adult and community, capital housing, and then administrative services, which would be like my salary, the lights, the electric, the technology, the, you know, electric bills, that kind of thing. So this is what our total came to in 2020. And then this is what we brought in. But if you look here, I put the ECC building because we have sale of assets, and I want people to understand that was really a one-time windfall, because that's 1.4 million, you know. So when you do the math, you know, we're really not that far ahead. We come out ahead in 2020, which we were anticipating that, but not quite as far as what we thought what it looks like we did, because we basically took 500,000 of that in 2021 and moved it over to capital improvements. If you remember that.
Yeah.
But anyway, this is where we're at. I just wanted to see, and again, I'm crossing out this part of the pie and that part of the pie, and just putting everything under adult and community. Keep it simple, because that's really what we're spending that money on, regardless of if it's Medicaid match, or if it's family or respite services, or if it's SSA services. All of that I want in one category, and then I could always break it down later. But for the purposes of this goes to the general public. I think it's a lot easier to understand if it's just under that one because that is a program in and of itself.
Okay.
So any thoughts, any,
Since the sale of the asset was a one-time fee, would it be helpful to have like to separate that out a little bit and to show that this is what the revenue would have been without that sale of the assets, and then this is what it was with it? So maybe put it under the total and, or have a subtotal and then do a total. Do you think?
you know, I was thinking about that as well. Yeah. Because that would be a lot more realistic of where we're at. And remember, we came out pretty good in 2020 because we weren't spending, you know, everything was shut down. So there was a lot, and we were not paying a lot. That Medicaid match number, you know, could have been a lot higher. So I think, you know, the main thrust of it was we weren't spending as much because we were shut down. So anyway, that's where we came out, but we did come out in the black, even if you take out the sale. So we did well for 2020. So we will take that, your suggestion, Sarah, and work on that. Are there any other comments or questions or ideas?
I'm not hearing any. Is there a motion to approve the 2020 annual report as presented? With those minor tweaks?
I'll make the motion.
I'll second it.
Mr. Gore,
Yes.
Mr. Huff,
Yes.
Ms. Jones,
Yes.
Ms. Marks,
Yes.
Ms. Piles,
Lou, you're muted.
she's shaking her head.
I don't know. I can't see her.
Oh, okay. Mr. Smith,
Yes.
Mr. Thompson,
Yes.
Hey, Lou,
Yeah, you're
What?
muted.
you're muted.
I know,
Okay.
it just came up that way. Yes,
got it.
Thanks, Lou.
you're welcome.
Okay, announcements. At the August meeting, the board will present a proclamation to Sue Vanderhoof in recognition of her retirement in May of 2020, a year ago, and service to the Lawrence County DD and to the family of Lorena K. Hall, who passed away last September, for her service to the Lawrence County DD Board. And do you want, the meeting is supposed to start at 6 o'clock, Julie. So do you want us there at 5:30?
Yes. If you
Okay.
can, that would be great. We are going to have light refreshments, and there'll be plenty of room to distance. We'll do it in the gymnasium though. That way, if they bring guests, we have plenty of room. But we didn't get to do this. We would have done that
Yeah.
if it weren't for the pandemic, but I didn't want to do it over Zoom. You know, I wanted to do it in person.
Oh, yeah.
Right.
And
Okay.
Aaron will be thrilled.
Oh, he will.
As you will.
Buzzy's heart.
So the next board meeting is August the 10th. The board meeting starts at 6. The presentations will begin at 5:30 with refreshments in the Open Door School Gymnasium. Okay, and now executive session per ORC 5123G4, preparing for negotiation and bargaining with public employees concerning their compensation or other terms of employment. Is there a motion to go into executive session? I'll make that motion.
Second it.
Thank you.
Mr. Gore,
yes,
Mr. Huff,
Yes.
Ms. Jones,
Yes,
Ms. Marks,
Yes.
Ms. Piles,
Yes.
Mr. Smith,
Yes.
Mr. Thompson.
Yes.
hey. See, hopefully I'll see you guys on the other side.
So everyone else is dismissed. And we will go over to the other side to executive session.
Thank you all for coming.
Thank you.
Yeah. Thank you.
Thanks.
But Tanner, you're not dismissed.
Okay. Okay.
You have to stay, Tanner.
Okay, are we waiting? Okay. Inviting you to join. looky there. I made it.
Hey, Debbie,
Again.
you made it to the other side.
I made it to the other side twice. Once going in and once coming out.
Done well.
I forgot to wake Tanner up.
What? Uh-oh.
Bless his heart.
Can Larry get him awake?
Oh, poor little fella.
Larry, can you see? There he is. Hey, Tanner.
Hey,
Hey,
Tanner.
hey,
Hey, Tanner, you made it.
You made it.
Okay. Is there anything else we need to discuss out here? Or
No.
We're done. Okay. I need a motion to come out of executive session.
I'll make a motion.
Thank you,
I
Sarah.
second it. Motion.
Thank
Oh,
you,
good
Tanner.
You're welcome.
And I have 7:32 PM. Are you calling roll, Julie?
Yes. Mr. Gore,
Yes.
Mrs. Marks,
Yes.
Mr. Huff,
Yes.
Mrs. Piles,
Yes.
Mr. Thompson,
Yes.
Ms. Jones,
Yes.
and Mr. Smith.
Yes.
All right. We already did the announcements.
Yep. And you're going at it again tomorrow, right, Julie?
Yes.
I wish you both good luck.
Yes.
Thank you.
I hope it's a good day tomorrow, Julie.
I
Thank you. I appreciate that.
Yes. I hope you
Yeah, I
have
hope it is too.
Thank you.
You're welcome.
Bless his heart.
It was good to see everybody, and hopefully in August we'll be all together again.
That's right.
So we
In
need a,
person.
yes.
Say,
We just-
say a little prayer that Diane will be able to walk to the car, or at least.
Oh, yes.
Yeah.
Or else I'll probably be on Zoom.
Well, we just need a motion now to adjourn in a second.
Is there?
got it.
Motion.
All right, Lou.
Who was other? Steve?
Steve.
Okay. Well, thank you everyone so much.
Thank you for all you
Hey.
do.
Adjourned at
you.
7:30.
Good luck tomorrow.
Thank
Yes.
you.
Yep.
I appreciate it.
Thanks, Larry.
Yes, for getting us to the other side all the time, Larry.
Yes. Thank you, Larry. We appreciate it.
See you all.